Alright, what's up everyone? It's Dr. Webb here. In this video, I'm going to talk about my match results. For those who don't know, I recently applied to fellowship, to spine surgery fellowship specifically, and I went on interviews. You can check out my interview trail. I gave a lot of tips throughout the interview cycle. Basically, I'll put the video up here, but you can follow me along as I go from city to city and kind of what my experiences were on the interview trail. And then match day was recently, and today I'm going to tell you guys where I matched at. Also, I want to answer some questions. So I got a lot of questions about a video that I put up recently talking about not going to class in med school, and also some other videos that people commented on. And I wanted to answer a few questions that I thought were pretty good questions. So I'm gonna answer those questions first, and then I'll let you guys know where I'm at. So you gotta stay tuned. All right, so the first question is from Jam8556. What's a good way to answer "tell me about yourself"? So this was a video about my spine fellowship interviews, and Jam8556, what's a good way to answer a question, I guess, when an interviewer asks you, tell me about yourself? I would say just be yourself. Just tell them they want to get to know you. Most interviews, you have already passed that initial screening maybe from an academic standpoint. So they just want to make sure that you're human and you're not some weirdo out there that's going to be detrimental to their program or to whatever medical school that you're applying to, residency program. So just tell them about yourself. Hey, I was born in blah, blah, blah. I grew up in this part of town. Outside of my studying, I like to do this. My passion is this. Very simple answer. You shouldn't even think about that. That should be very easy to answer. From John Locke, what's the difference between an orthopedic spine surgeon and a neurosurgeon who does spine surgery? That's a very good question. Orthopedic surgeons go through 5 years of surgery training, residency training after medical school, and then to become a spine surgeon, orthopedic spine surgeon, you have to do a 1-year fellowship in spine surgery. That's what I'm doing. So I'll be an orthopedic spine surgeon. To be a neurosurgeon that does spine surgery, you have to do 7 years of residency after medical school, and some people still do a fellowship. Some neurosurgeons still do a fellowship to get a little bit more experience in like deformity surgery or degenerative surgery, which just means it's like arthritis of the back. So the main differences are the length of your training. Neurosurgeons do more brain and spinal cord, such as back surgery. Orthopedic surgeons, we work on every part of the body besides the brain, the belly, and the chest. So we work on the legs, the ankle, the hands, arms, shoulder replacements, knee replacements, hip replacements, broken ankles, broken legs, broken forearms. We do it all. So, but as a spine surgeon, you can be a neurosurgeon or a orthopedic surgeon. It just depends whether you like brain more, or if you like other parts of the body, like joint replacement. So, good question. Next one is from Eduardo Santos. As orthopedic surgeons, do you get to work with nurses or just PAs? We get to work with both. In the hospital, I consider it a team. Everyone from housekeeping to the janitors to the person at the lunch, the cafeteria, everybody's part of a team to take care of patients and make sure patients are taken care of in the best way possible. So I work with nurses, I work with PAs, I work with first assists, I work with nurse practitioners, I work with medical assistants, work with all. Everybody works together as a team. Next question from Sean Thomas. Were all the expenses out of pocket? And that's referring to the interviews that I went on. Yes, they were. Unfortunately, it gets very expensive. So if you are in college, I would say open up a small account or put money aside each month, $50, $100. That way you can have money set aside when interviews come up. What I did was, in residency, I knew that fellowship interviews were coming up. So at the beginning of residency, I opened up a bank account, a separate bank account, and I just put money into that account each month. And then when fellowship came around, I already had saved for 3 or 4 years. So I had a good amount of money to kind of lower that cost of fellowship interviews. It gets very expensive, especially if you're going on 12, 13 interviews. The flights, the hotels, the Ubers, your food, none of that's taken care of. You have to pay for that all yourself. So make sure you save and spend wisely. Save money by staying with family members, making your own food and bringing it with you. There's a lot of different ways to save money when you're going on interviews. Next one is from Jordan Wells. Is medical school like grammar school, Monday through Friday, or is it more like a few days a week? Well, it just depends on if you go to class or not. Most medical schools are Monday through Friday. You go to school from 8, until the afternoon, 3, 4 o'clock, and then sometimes you have lab in the afternoon. Sometimes you go to the hospital and spend a couple hours just shadowing a couple doctors, or sometimes you have the afternoon off. You may go to do a autopsy at the coroner's office, or you may go do some research. So it depends kind of on what time of the year it is and what school you go to. So most of the time it is Monday through Friday, but you do have some time down throughout that time as well. So for the match results, you guys ready? Drum roll, please. All right, so I'm going to Dallas for my fellowship. Very excited about that. It's a very good program, right outside Dallas, actually. And so I'll be there for a year. I got 1 more year of residency, and then I'll be heading out to Dallas for spine fellowship. I'll still be doing videos during that time, let you guys know how it is to be a fellow and kind of day in the life. And I'm really excited about it. Check out my other video, like I said, about the interview process and kind of what I learned along the way, and hopefully you guys will pick up some tips. Hard work does pay off. Been working really hard these last 4 years in residency so that I can get to this point and actually match. I'm so excited about that. I'm going to be a spine surgeon. I look forward to making more videos about the field of spine surgery and why I like it. So stay tuned, and my next video in the next couple weeks, I will put a video out about why I chose to go into spine surgery, some pros and cons that I've found about the field, and some other videos out there that I want to make for you guys. I have them coming out soon. So make sure you guys subscribe. Thank you guys for watching this video, and we'll see you next time.